as possible. But this is not intended to be overly formal, so please feel free at any point to interrupt with a comment or with questions in the chat box. I'll try to pay attention to that as we go. And then I'll just start with this fairly short PowerPoint that goes over some of the basics about our program. And then what I really want to have happen is that we have time for our faculty and our former alumni to be a sounding board that you guys can ask questions and learn as much about us as you can. Just a quick plea to follow us on Twitter. We're new to the social media game, and you can see our Twitter handle here. And this is a picture of a nice fall day here in Denver, looking from the Children's Hospital back towards downtown. So as far as an agenda, since we're all probably either at home or in clinic with noisy backgrounds, just please mute if you're not asking a question, just so we don't get too much feedback. My kids are busy watching something on Disney Plus, so my streaming may not be great and it may get loud, so I'll apologize in advance if that's the case. What I want to do is just briefly go over what we'll talk about. So a bit about Children's in general, discuss our team, which you really want to emphasize how much of a team it is. So it's not just our faculty, but it's also our wonderful APPs, our biofeedback physical therapists, our nurses, our residents, our alumni, that we really consider this fellowship a family, and we hope to show that tonight. We'll talk a bit about our residents, and we're hopefully going to have some of our former fellows and current fellows on, so that if you have interest, we can have them chime in or have you guys ask questions. I'll talk about the structure of the fellowship and each year, and what the experience is like and what we hope for it to be like. And then again, the important part really is probably the Q&A session. I do want to just take a moment to say a special thank you to Melissa Gray. She's our executive administrator for the fellowship. This fellowship would not be possible without her, and this is really not hyperbole. I mean, she's the glue that holds it together. And I can't say enough how much just in the last 6 months, 8 months that I've been doing this, I would not be able to do any of it without her. And this tonight is really a testament to her organization with it. So thank you, Mel. So here's just some of the bright colored pictures of Children's. This is the entry lobby. And, really just to point out, it's a brand new, I guess it's more than a few years old, but it still has that brand new feel. And bright colors, really outstanding facility to work in. As far as our faculty, we'll go through each of them in alphabetical order. Dr. Caldwell, he is our point person that runs the urology program out of the Colorado Springs Hospital, which is a separate freestanding hospital with Children's Hospital Colorado. He's also a former alum, and so it'll be a great resource for you guys to ask questions about the fellowship, and then how the transition to practice works. Dr. Campbell, I'm not sure, I can't see really right now who all's on the line or not, but hopefully all of them will be. Dr. Campbell is our second most senior partner behind Dr. Wilcox, and has a wealth of institutional knowledge about our program. He is an outstanding surgeon and one of our kidney stone experts. And I think in terms of most of our fellows, in terms of what they have gone on to do, he probably has more of an impact on their clinical practice than almost anybody else, because he's probably the busiest of us clinically. And then there's myself, Tai Higuchi, who is, I think, a real unique aspect to our practice. He's an adult reconstructive trained urologist who also works with the transitional care that we have here at Children's. So he comes over twice a month and does a clinic, and is just brings that transitional piece to our practice. And I think a lot can be learned from him. And then Kyle Rove, who is one of our former residents, who has come back, and this is his third year of practice. He is clinically become very busy very quickly. Also has really a lot of strengths in the area of informatics. He leads our surgical informatics for Epic at our hospital, and so he's always advocating for our group and our needs in that realm. And then from a research standpoint, has really championed ERAS, or enhanced recovery after surgery, within the pediatric urology realm, and doing a lot of great work in that space. Dr. Vimala Kanda, who is our residency program director as well. She leads our research enterprise, not just for children's, but also for the whole division of urology, and as an NIH-funded researcher in the area of outcomes research, and a great asset for our fellows when it comes to research training and practice. Dr. Wilcox, who's the chief of pediatric urology, he's also the surgeon in chief for our hospital at Children's, and was formerly the program director for the fellowship until last year. He passed that torch on to me, as I think his plate had become overly full, and is I think probably the driving force for why people want to come train here. Just an outstanding mentor and clinician, and I think if you talk to our former fellows, they would all agree. And then Cindy Buchanan, and another unique aspect about our program, we have a funded psychologist that works in our department and sees a lot of our complex patients, but even also, patients that have complex voiding dysfunction, provides that piece of their care, which I think is unique and a lot, something that we can learn and take to practice. Even if you're not going to have a psychologist in your practice when you're done, some of the tips and tricks that she provides can be helpful. Plus, she leads these really good trust exercises that we do at our semi-annual retreats. The hard part with Zoom is I have no idea if anybody is laughing at anything I say, so I'm just flying blind.
Nick, can I just interject there? Because Dr. Cost is way too modest to say anything about himself. But Dr. Cost has a very unique practice in oncology, in that he essentially treats all or the vast majority of the renal tumors in our hospital. He leads the children's oncology group as the surgeon in charge of all the renal tumors. So there is a huge oncology practice that you'll see here. So, and I'm sure I've embarrassed him.
Duly noted. I'm fully embarrassed, and we'll make sure to edit that part out of the recording. Moving on to more important things, our advanced practice providers. We have 4, Adriana Bear, John Colby. John works with Dr. Caldwell on our practice in the Springs and down south, Marguerite Korber, and then our APP lead, Brian Miller, who I believe is on the call as well. I think we intentionally actually have the fellows spend some dedicated time with our APPs because they're outstanding at what they do, and they also, I think, can show some great examples of how to integrate APPs into your clinical practice and make your practice as efficient as possible, so that everybody's, as we say, practicing at the top of their scope. I can tell you personally, Tuesdays, which is my clinic day, has become my go-to day to add on oncology cases, and I do that because I know Brian will always be able to cover my clinic, and honestly, I trust him more than I trust myself to see patients. So he's really outstanding, and I would say that for all of our APPs. We have a dedicated physical therapy team that sees and does biofeedback with our patients, and I think I would say that our outcomes with voiding dysfunction really are unrivaled, and a lot of that has to do with a really great PT team. And then we have an outstanding set of clinic and OR nurses and support staff that I think as a trainee, the important part is that they're there in so many ways to support you as a fellow that a lot of attendings don't have. And so you're freed up from some of the things that would otherwise tie you up from a quote unquote service standpoint that allow you then to focus on learning, getting in the OR, spending time in the OR, not having to necessarily deal with outside calls and things like that, running down some clinical materials that otherwise we can lean on this incredible support staff. And in the OR as well, just outstanding urology leadership. Nicole Stewart here on the far right is our OR urology lead. And then how we get together in the COVID era. Again, we were very much a family, and we have these biannual retreats, and we get together and we do activities. We've done Top Golf. We did curling last year, which was like a 4-year effort on my part to get us to curl, which it was great. we usually spend a lot of time with each other. And so COVID, I feel like, has hit us hard from a morale standpoint, but we still get together in our monthly staff meetings. And here's a screenshot from that recently. And I think any talk about our program would be left short if we didn't mention our outstanding residents. I think they are close to each other in a way that I have not seen before in a group of residents. They really love being with each other. And I think probably the thing that I'm most proud about is over the last 2 or 3 years, there's been an enormous push, not just from the faculty and from the program, but really from the residents from the ground up to make us a more diverse group. And our recruitment efforts have really paid off to make our family more diverse. And I think that's something that we prize and we want to emphasize not just at the resident level, but also at the fellowship level. And then, really, as I mentioned, our family, we need to talk about our former fellows and what they're doing. And we have intentionally, over the last few months, as we started our Twitter account, we've been trying to tweet as much as we can about our former fellows because we think that they sell our program probably more than anybody else can. So I'd like to go through each of them just a bit. Amy Howe was our first fellow. She was a former resident, or she was a resident here in Colorado and then stayed on. She's now in Minneapolis having a very thriving practice. And I think in our personal conversations, so she and I graduated at the same time. So I've known her for a long time. And, she repeatedly has said how, well she was prepared due to the training here. Dave Chalmers, who I think is going to be on if he's not on already. He left here and went on to Maine Medical, where he's actually the residency program director. I am almost positive that this picture was the last time that Dave shaved.
Chalmers is on too. Chalmers.
Okay.
That's true. I was thinking the same thing.
Yeah.
Still have that tie close
But
on.
I know he's showered at least once since then. So Erin Grantham was our next fellow. She's practicing in Billings, Montana, just up the road. And I think a great example of where, she went into an area where there was not previously a pediatric urologist, and, she felt so, trained well enough that she's really on her own and, doing a great job of building a thriving practice in that setting. And Dr. Caldwell, who I've already mentioned, he was our fellow and then has gone on to join us as a partner. And I think far exceeded anything that I ever taught him to do. And he, is it like Kung Fu that the student has become the master? Really outstanding pediatric urologist. Alonzo Carrasco, he went on from here to Children's Mercy in Kansas City and has really built a thriving reconstructive practice. One of the things I'm going to emphasize, and I think I saw it probably the most with Alonzo as the first one, was that he knew he wanted to do complex reconstruction as his career, that he wanted to join a busy academic group and be the person to do the complex reconstruction. So he dedicated a lot of the second half of his first year and then his second year focusing in that area. We really want to emphasize that this fellowship is kind of a choose your own adventure novel, that we're here to help you make your career, not to pigeonhole you into what we want you to do. And so we really try to provide a lot of freedom for you to pursue your goals. And I think Alonzo really took advantage of that and has built on that and then has an outstanding practice as a result. Dr. Saltzman, she is currently at the University of Kentucky. And I think much like Alonzo, had a specialized interest and was also interested in oncology and spent a lot of time doing research in that area. And in all honesty, probably has published more in the space of pediatric urologic oncology in the last 3 years than anybody else. And was recently awarded the SPU research grant for really novel work on microRNAs and germ cell tumors in patients with DSD.
Amanda's on too. Amanda, if you want to.
Great.
Hi, you guys don't want to see me because I'm laying in bed because it's 8 o'clock where I am.
Thank you for being here, Amanda. We appreciate it.
Moving on to Dr. Walker, who I think also was going to try to, he had texted me a minute ago, he was going to try to make it maybe a few minutes late, but Dr. Walker.
He's here too.
Awesome. It's like a family reunion.
It is.
He is at the University of Tennessee, Chattanooga, and as I think probably could explain as well that, even if you come into fellowship, not necessarily having, a specific research interest or clinical direction, that the freedom combined then with the support to do what you want allows you to really pursue your interests. And I think, Jonathan went on to spearhead a number of research projects, which we even are continuing to work on together, even after he's gone. And I hope that all the fellows will kind of chime in at some point, maybe not right now, but later on we have a second to just talk about their experiences or what they thought were strengths of their time here. Sarah Hecht, again, I'm not sure, I can't tell who's on or not, but Sarah is
He's
now
here.
in Portland, Oregon, as opposed to Dave, who's in Portland, Maine. Portland, Oregon, at Oregon Health Sciences Center, and where she had done a residency, and she went back there. And again, I think kind of like Alonzo and Amanda had a specific interest, and then developed some new interests while she was here, but was really given the latitude to develop that, and has become a real leader in the field in the area of device development within urology and pediatric urology. Also has a great interest in medical education, which she's carrying on in her practice there in Portland. Dan Hahn is our second-year fellow, soon to graduate. He will also soon to be joining Stanford. Dan is going to join a very small community of pediatric urologists who are heavily involved in lab-based research, and is going to have protected time for that. And I think a good example of where the trainees that we have don't all follow one path. I mean, in a lot of ways, I don't think any of our fellows that we've graduated have done the same thing. And Dan will expand on the work he's doing here in the lab with a neonatal rat model, rodent model, I should say, of obstruction and potential novel drug delivery for that. At some point, he may want to chat more about that. And then Dr. Michelin, she's our current first-year fellow and came to us from Columbia, and is still is not yet accepted a job for next year, or the year after next, I should say. But I think, again, can chime in about the opportunities that are here in terms of developing a career interest, and how hopefully that's been well supported. I promise we're not making any of these people say anything. This is they're all saying it of their own free will, hopefully. As far as our future, what fellows, we have Kristen Meyer, who's coming to us from Detroit, and she'll be joining us next year. I don't know if she's on or not. And then, maybe you for 2024. So as far as the structure of the fellowship, the first year is the clinical year. I know that varies from program to program, but ours is the first year is clinical. And in the first 6 months, you spend time with each attending, 1 month with each. And so in that time, you prioritize their OR and clinic days. It's not that you spend all your time with them, but you try to get some one-on-one time with them, and you cover a backup call on the days that they're on call. And then, as I alluded to before, in the second half of the year, you select where to spend your time. Obviously, we want to make sure that things are covered and whatnot. But if you have a special interest that you wanted to pursue more, we want to facilitate that. We strongly emphasize going to clinic, even though the ORs are very busy, and we'll talk about some numbers with that. It is really important to us that you spend time in clinic. So we have started a program where we're having you do 25 half days of clinic in that first year, and then in addition, 5 of our multidisciplinary clinics, and we have a variety of different multidisciplinary clinics. But the reality is that clinic is where patients are treated and seen first in most cases, and understanding what the workup is before surgery and then how we care for them after surgery is important. And there's really no way to know that if you're not in clinic. And I can speak from the flip side. After 2 fellowships and hundreds of days in the OR, I think between those years I went to clinic a total of 5 days. So when I showed up as a faculty to do clinic, I was ill prepared for how to practice. And the reality is you do about a day of clinic to generate a day of OR. So, you need to be prepared on how to manage clinic and do it efficiently. And I think that that's a lot of what you can learn here, is seeing how all of us do it differently and what you like and the way that they're structured. I think we all structure our clinics differently. We're not uniform. We don't mandate that everybody does it the same way. And I think that's a strength. As far as OR, we offer open laparoscopic surgery and robotics. Currently, we do our robotics at the university, and Dr. Caldwell also does robotics down south at one of the hospitals down there. However, we have secured funding. We will be having a robot in the next year here at Children's. So we'll no longer need to take the patients over there to the university for that, which will be great. As far as call in your first year, it's backup call with kind of 3 exceptions. The night before and during the resident in-service exam, we have the first year fellow cover. And then we have the resident cover, the fellow cover for resident ski day and resident golf day. So 2 of those days. So it's a very minor primary call burden, and the backup call, I think our goal is not to make it onerous, but is really just to give you an idea about what we think about as attendings when we see patients and how to think through and make decisions when calls come in. As far as some of the numbers around volume, we had over 17,000 clinic visits in the last year.
Nick, can you just
yes.
say how often backup call is?
Yeah, so it's essentially 1 in 7 because you take backup call with whoever you're on with for that month. Thank you, Dr. Wilcox, for pointing that out. Maybe I inadvertently made it sound like it was every day. That's not it at all. It's backup call essentially 1 in 7. So with whatever tending you're on with that month. And we did over 2,500 OR cases last year. So there's a fire hose to drink from in terms of the volume surgically. Again, as I mentioned, I think that the experience you get with our advanced practice providers, with our biofeedback team, is outstanding and unique in a lot of ways. And we have a network of care, so that we have, as I've mentioned, the hospital here in the Anschutz campus in Aurora, but we also have a freestanding children's hospital down in Colorado Springs. And also, we have a freestanding children's hospital in the south suburbs of Denver and one now in the north suburbs. So we have 4 dedicated children's facilities in that network of care that just provide, lots of opportunities for you to see different practice settings and, what the potential options are, what your career might look like. Also, in terms of what we see, we have clinical experience and kind of team-based care in all of these areas: spinal defects, fetal urology, DSD, minimally invasive and robotic surgery, oncology, transitional urology, stone disease, valves, or probably more broadly what we consider K-cut or congenital anomalies of the kidney and urinary tract. That we work very closely with nephrology on that, and then also the pelvic floor biofeedback. Then the second year is the research year. We do try very hard in the first year to have some milestones such that you're ready to hit the ground running for that research year. And one of those things that we've just instituted this year is a first try, but I hope we'll be successful, is that we're going to have the second year and the first year fellows switch their roles in the end of the year, probably next month or in April, depending on kind of what they want it to be. But where you have an opportunity in that month as the first year to have dedicated time to get things up and running, so that in July you can hit the ground running with your second year research. And then for the second year fellow, it's an advantage to get back into the clinical arena a bit more, maybe brush up on some cases you haven't seen, things you would be anxious about doing in practice before you go out into starting your practice. As far as the opportunities in research, this is both clinical and laboratory-based research. There's opportunities for research in areas like medical education. Also, there's opportunities for continuing your own education. So there's really good coursework that can be done in biostatistics and study design. And if someone was super motivated, there would be the potential for to get a master's of clinical science if you were really dedicated. Also, I think one of the good aspects about the second year is that you serve as a junior faculty. So you have a half a day of clinic or OR per week. And that is not like a Medicaid clinic or anything like that. You see patients that get added on just like everyone else. And you do on-call as primary call, as an attending call, I should say, a 1 in 7 with us. And the cases you generate from that, or the new patients you generate, you see in clinic and you take care of them. And then in large part, those get passed off to the next fellow, so that it's not like just a circumcision clinic or anything like that. I think hopefully our former fellows can chime in about this experience and how it hopefully helped them feel confident going out. Now, you're not on an island. We do have an attending assigned every day to be around as needed, and but they're really there to serve as a resource for you guys to call on, not necessarily to watch over your shoulder the whole time or anything like that. As I mentioned, clinical research I think is very robust. Dr. Vimalakanda leads our research enterprise and is an expert in outcomes research. I also do some oncology related outcomes research. Dr. Rove, his emphasis with ERAS and informatics. The lab-based research, we have two of us that do lab-based work, both in the area of lower urinary tract physiology. Dr. Wilcox, his lab focusing on bladder development and the effects of urinary obstruction. And then I have work looking at the impact of chemotherapy on pediatric bladder function. But there's also research outside our department. We've had former fellows do work in a variety of areas. Dan, for example, right now is actually in the lab of one of the nephrologists, Dr. Serrano. And then, as I mentioned before, the classes that are available, if you're interested in that, we would really encourage people at least to take some of these one-off classes and things like biostats and study design. As far as education, we do have a lot of dedicated time for education. We have Monday grand rounds. And then there's Friday afternoons is dedicated for pediatric urology specific teaching. And I think, we have like a pre-op indications conference, an interesting case conference, and then usually an additional hour of lectures. Actually, as Zoom has taken off, we have tried very hard to get our former fellows to Zoom in for those and present some of their own interesting cases and still feel like they can reach out to us. And we very much want them to feel like the support that we provide doesn't end when they graduate, and that we're here to help them, and also that we love to learn from them, because they know a lot more than we do about some things as well, and so we love to hear back from them. As far as meetings, we would fund and expect our fellows to go to the main meetings, the spring AUA, the fall SP Fall Congress. That is, if we ever get back to going to meetings. There's also the Pena colorectal course, the Cincinnati course. I think the fellows have found over the last few years to be a good course. And then there's the deflux course, which we would support someone going to if they're so interested. As far as just some nuts and bolts, the application process, you do have to graduate from an ACGME or a Canadian or CPSC accredited urology residency. And then if you're interested, as many of you already have, you would apply through the AUA match. And here's our match number. You can reach out to us if you need that. I think it's pretty self-explanatory on the website. And the deadline for applications March 1st. So we wanted to have this a few weeks ahead of that so that people who were interested and have not yet applied could hopefully learn a little bit about the program, and then we would hope apply. Our plan is that we're going to have two different interview dates. That's up to you which one you'd like to attend. They will be Zoom. Again, unfortunately, we wish we could do it in person, but it will be done over Zoom. And so they'll be on Fridays, either the 16th or the 30th of April. And we will have an optional evening event the evening before, very informal, just a chance to kind of get together. We'll have some small breakouts, share a glass of beer or wine, and chat and just hopefully get to know each other. Just kind of like this event, we're really hoping that people, as best they can over Zoom, get to know who we are and feel like this is a place they want to look into more and apply to. Here's a quick picture of the fellow workstation. So this would be your office. And I know for me, when I graduated residency and I went on to my oncology fellowship and I had a cubicle, like it was, a revolutionary experience. I had someplace to put up pictures of kids and buy a little mini fridge. And anyway, I found this to be a great asset as a fellow, to have someplace dedicated where I could do my work. And so here's one of the fellow cubicles. And then Denver, just in general, I think Denver sells itself. Anybody that's lived here would say that it's an outstanding place to live. Having lived a number of different places around the country, I will never leave. It's a beautiful place to live. Great weather, great outdoor sports, hiking, skiing. It's a good example in this picture. You can see great snow in the mountains, but at the same time, this is a beautiful spring day. So, you're probably here in Denver with temperatures in the 60s, and then it's getting, fresh powder in the mountains to ski on. Professional sports, I'm personally a huge Avs fan. Dr. Campbell and I share a season ticket package that hopefully one day we'll get back to having in-person sporting events. So he and I can go to those again, but we have all the major sports teams, a good restaurant scene, and a good arts scene. So really anything you would be interested in, we hopefully have here in Denver, not just professionally, but also then, the time you'll spend outside of work. And we do very much want to emphasize, we expect our fellows to have a life outside of work. I operate on Mondays at Children's, and I would say probably the majority of what I talk about in the OR is what people have been doing on the weekend, because for the most part, everybody, does exciting things. COVID notwithstanding, the last year has been a bit boring, but in general, we're all getting out and about. So here's just a quick screenshot of the important players that are hopefully on the call. And so what I really want to do is open it up. And I didn't see any. Let's see the chat here. Is there anything? A nice tone. But feel free to chat in on typing or just ask questions as they come, and that's what I hope we can open the next 30 minutes or so for, and we'll take as long as we need to or as short as we need to, whatever you guys want. The other thing I would say is if any of the former fellows want to chime in unprompted, please feel free. I don't know how to moderate that, so I hope we don't talk over each other, but thanks for listening to me drone on and on.
Hi, Nick and everybody. It's Dave Chalmers. I've been dying to chime in and say hi. Nick, that was a really great presentation, and I feel like it accurately represented the fellow experience. I think the perspective I was just going through in my mind was just how happy and excited I was to be a fellow at Colorado. I'm going to try not to be too hyperbolic, but my residency experience was pretty intense. And Colorado was just a joy. I actually loved coming to work every day, even being on this call. I see myself just smiling and grinning like a goofball, just seeing all these faces and seeing that old fellow cubicle. I really miss it a lot. It was great training. I felt so well prepared to go into practice. And have just zero regrets. I'm borderline jealous of all the applicants who are might have Colorado to look forward to. It's really great to see everybody.
Yeah, I totally agree. And I would echo what Dr. Wilcox was saying about Nick being modest. The way he talks about this fellowship program, I think undersells every aspect of it. I think this is the best fellowship program out there.
We need to mute.
None.
We need to mute Sarah's mic.
Yeah, I've heard that before. Funny enough. Go ahead and mute Sarah. No, I just feel so lucky to have trained there, and I think I've made that clear to the people who still serve as my mentors. But I will mute myself and be here to answer questions.
I have a few specific points I wanted to kind of expound on. So just to really emphasize that this fellowship is geared towards you. Like you're not going to be pigeonholed into doing, going down a certain path. This basic science thing I'm doing, everyone really supported me, finding a mentor and getting the grant and with all the application stuff. And everyone was super supportive, and they'll support you in whatever way. Another thing I want to emphasize is call is not onerous at all. There are certain programs where you take primary call Q2, or other programs where you have to come in even though you're in backup. That's not the case here. It's really nice, and it's really geared towards your learning. And just as another emphasis on that is that the scut work and just the miscellaneous stuff that you often have to do or that you're used to doing in residency, that you don't have to do that here. And a lot of other places you have to do that. So just keep that in mind. The junior attending year is really crucial. It's been really great. I think having the experience of seeing your own patients in clinic and doing your own cases, so this year I did a nephrectomy with Nick. I have an augment coming up. I have 2 pyeloplasties and just a bunch of other great cases. And so when he says that you're doing cases or you're seeing patients that you're not being dumped on, that's really true. And another thing that's really critical, I think, is you get time off to study for your boards. And so I don't think any other program has this, where you're right in the fire of clinical training, super busy, and then you have like 30 minutes to study every night, and you have to take your boards. I was talking to the other fellows my year, and they're super stressed about it. So I think that's just another emphasis on how much they care for you as a fellow. And final thing I think I'll say is that you get every holiday off. So, and they make that a point for the fellows to get every holiday off. So just another example of how much all the attendings are here to support you. And so, so yeah, anyway, I'll stop there.
I guess I'll chime in. I'm the first year fellow currently. My experience in residency was kind of minimal in pediatric urology. So I will say being here, you'll get exposure to all of pediatric urology. I feel like there's really no aspect that is not represented here in the clinics and the OR, and then they'll have probably the robot soon, which would be great. Kind of to echo what Dan said, and most of the other fellows, all of the faculty are super supportive, and they're very encouraging. They're really invested in your education and your career development and your life after fellowship. So it doesn't just end after you graduate and leave, but they're really there for the long term, which is wonderful. And then also, like Dan said, the ratio of service to education here is very favorable. I don't think that there's really many activities that are not educational that I have to do here. The residents are amazing, very helpful. They take care of almost everything that needs to be taken care of. So it makes my life a lot easier. And then in terms of the research here, it's really what you make of it, and you can tailor it to what you're interested in. I want to do graduate medical education. I was able to find a mentor here, get involved in projects. So it's really a wonderful opportunity to explore what you're interested in. And then lastly, like some other people have mentioned, that a junior faculty position as your second year really prepares you to be independent and think through things on your own. Me and Dan basically did a piloplasty by ourselves a couple weeks ago, and it was a great time. So, and lastly, Denver is awesome. Love it. Highly recommend it. But I will mute myself and here for questions.
So I just want to say something real quick about the research. I echo what everyone has said, but I came into fellowship knowing nothing about research, and really, doing case reports, things like that. And so I really kind of had no idea what I was doing. But with the mentorship there, was able to kind of figure it out and publish a few articles and, learn to write a grant and all of that. And actually the grant that I wrote was completely done not when I was a fellow. And I reached out to several of the people there who read it and gave me a lot of feedback. So don't be intimidated by that if you don't really know much about what you're doing, because you'll get the support. And I would also say don't worry about the robot, because you will get plenty of robotic cases there, even though there is not quote unquote a robot there, or there is one coming. But where I am now, I'm the laparoscopy robotic person. So that is not something that is going to hinder your training.
Well, I don't want to be
Personally,
the only former fellow not to say something, so I'll just put a quick plug in, and I don't want to repeat all the things that have been said because they're all very accurate. Yeah, I think the bottom line about the program of Denver, it's very obvious that from the very beginning, the fellowship program was set up as a training first program. I think Dr. Wilcox has kind of led has taken the lead on that, and in every facet of your training, it's very obvious that the goal is not for you as a fellow to serve a purpose for the attendings, but really more so that they serve a purpose for you to make sure that you are trained well, that you have a good time, that you learn, and that you're able to go and do whatever you want in your career. And I think that's a real testament to how the program was designed. And I think that it's a program that even in the 2 years I was there was continuing to develop and find new ways to benefit the fellows and the residents, because it's all about training at the bottom line, and you're not just a cog in the machine, that you really are a person. And the relationships that I made in fellowship with faculty and mentors will, and honestly co-fellows and residents are ones that I will keep the rest of my life. And so I can't say enough about how, I mean, I was happy when I matched there. It's where I wanted to go. But I don't even think I really realized how great of an experience that it was being there. And I'm reminded that honestly every day that I'm working.
Well, thanks for
I was
everybody
just
for
gonna say one
chiming.
quick thing.
Oh,
I
yeah.
think for me, actually, the having the laparoscopy experience was really valuable, because I had a ton of robotic experience in residency, but very little pure lap experience, and so I think that's actually been a real boon for me.
I appreciate everybody, chiming in to say such kind things about the program. I think maybe now would be a great time if any of the potential applicants have questions. They can be directed to any of the faculty that are on, or to the former fellows, or Dr. Caldwell, who would be both of those categories. If not, I didn't know. I know we have a couple of our residents who are actually on the call as well. Sorry, maybe I cut somebody off. Yeah, sorry.
Sorry, thank you guys for hosting this. I have a question about kind of how the fellows interact with the residents, and kind of how many residents are on service at a time, and kind of how we participate in their education, and kind of how it works in terms of scrubbing for cases, or if we often double scrub or lead them through cases. Can talk a little bit more about that.
Yeah, I'll just say something really quickly, and then actually, if maybe the residents that we have, I think I saw Dr. Bidikoff and Dr. Halstead both on, they can chime in. And then maybe as well, we've got the unique good fortune to have Dr. Mulakhan, who's our residency program director. Maybe she can comment about that as well. I would say at any time we have two residents on service, a senior resident and a junior resident. And I would say almost every day we have multiple ORs running and multiple clinics. So there's always, a unique opportunity for the residents and the fellow to be doing things independently. And then, we do have the unique times where there's things line up such that the resident and the fellow can operate together as a team, that we try to take advantage of when we have those times as well. So I feel like it's a good relationship, but I think you'd probably be best served by hearing what the residents have to say.
Hi, I'm Valeska. I'm one of the residents here. I agree with everything Dr. Koss said. There's usually enough going on at one time to where the two residents on service have an OR they can go to, or a clinic they can go to. And it's separate from what the fellow is doing as well. The residents meet their case logs within the first 2 to 4 months of them rotating there. So that's not a concern as far as just working for different cases. If there's a big case going on and the resident wants to see it, they'll double scrub with the fellow, but it's never like a competition kind of role. It's more so everybody's there to learn, and they try to get you involved whenever they can. So it's really nice. I would say our relationship with the fellows is really, really good. It becomes a friendship. We're never competing for anything, and we're definitely learning from them throughout. So it's been great. Yeah.
That's great. Thank you.
What I think is that basically on Thursday or Friday, the fellow and the senior resident get together and allocate the patients and who's going to do the cases for the following week. And we have a obligation to the residents to get exposure and see good cases, and we have an obligation to the fellows to make sure they can practice independently when they finish. And in general, I think we have to I think we have enough cases that it's never a problem with cases. It's never been a criticism that I believe residents have leveled at us that they don't have enough cases to do.
Yeah, I would agree with that. I think that we tend to get very high evaluations from the residents at Children's. And I think that especially in this sort of current day and age, the ability for peer teaching is fairly limited, and having the second year fellow as a junior attending offers that opportunity for peer training with a junior resident or even a senior resident, depending on the case. And you know, Dr. Halstead and Biddick have both been through that experience, but I think it allows them a certain amount of autonomy, and it also allows the fellows an opportunity to learn how to teach someone that's a little bit more junior and take them through the case. So I actually think that having a strong residency program and a strong fellowship, really they sort of are positive reinforcement for each other.
I agree with everything. Logistically, the way it works is at the end of the week, the case list is made, and then I take it to the fellow first to see what cases they want. I write their names down, and then I divvy up the rest to myself and the junior based off of our best judgment. And there's very rarely an issue, mostly because of the high case volume. I think I was there when COVID hit, and there were issues where I was like, dude, we have 2 circumcisions between the 2 of us. And then Dan said, well, that's like 1 pyeloplasty and 2 circumcisions between the 3 of us. And then I was like, fair enough. You know, we usually, they're extremely reasonable. You know, we understand the new fellows are usually hungry for bigger cases. And we accommodate that. And then, you know, in the later part of the year, they're like, I think I've done enough, you know, pyeloplasties, maybe you should have a go at it. I think it's a pretty collegial relationship. And I think the fact that the fellows we matched have been so understanding has been a huge plus in my residency. I'd say one of my favorite parts of it is actually going through simple cases I've done a ton before with the second year fellow. It's just super fun. They're good people. It's good teaching. So I would echo that.
Luke, I'll pay you after this is over.
Officially, I have to decline that because of like morals and stuff. So, you know.
Nick and Chalmers again. I was just curious about the Friday afternoon conference and didactics. I don't think that was brought up yet, and I remember that being a bit of a highlight to end the week. Felt like as a fellow, I was sort of in charge of the content and really look forward to it. Is that still the routine? Sort of Friday afternoon get together.
It is, and thanks for highlighting that, Dave. I apologize. I'll make sure I add that in the future. But yeah, as a second year fellow, you're in charge of conference, and it really can be whatever the second year fellow wants it to be. We do have a core curriculum that we make sure everybody every year we go over every necessary topic, but outside of those specific things, you know, it can be focus on different areas. Usually it's a 2-hour session from 2 to 4 on Friday afternoons, and the first hour is usually a half of it like in a pre-op conference, and then the second half interesting cases. And that's a time for us to really teach the residents, actually the junior resident most of the time, and we usually have the fellows really leading that and trying to teach in a very directed manner about clinical cases. And then the second hour is usually either an invited speaker from, you know, now with Zoom, kind of, you know, from around the country or world, but then also an opportunity for the fellows to learn, you know, good presenting skills. The reality is in the last year, we've, you know, seen that you have to be good with PowerPoint, you have to be good with presenting over Zoom, and you know, if you have an interest in an academic career, that's going to be a big part of it. And so it's a good opportunity for us to help strengthen our fellows, kind of, you know, polish their presenting ability. And so, yeah, I think that's still there. And again, Dave, what we're hoping is, and I'm not sure how this is going out, but I know we've had Jonathan, I know Amanda, Aaron have presented their cases in recent months, you know, various interesting things. And I think we have a goal of circulating that Zoom link to all of our former fellows so they can continue to stay in touch that way if they'd like.
Another thing, sorry, I showed up a little bit late, so you may have already had talked about this, and if so, then disregard. But I think I heard you briefly mention something about faculty mentors. I think that was a huge part of my training. Is that something that you can comment on, Nick, about getting the fellows plugged in with mentors once they show up?
Yeah, so what we do is we actually encourage you to meet with each of the faculty one-on-one in the first 3 months. And, while we, have ORs going on and clinics going on every day, we understand that, you're carving out your own time, and time management skills is something that is going to be important in your practice going forward. And so, we all understand if you say, Nick, I'm going to have to buzz out of this case, someone else is going to cover because I've got a meeting with Dr. Wilcox or Dr. Campbell, Dr. Mulakanda, Dr. Rowe, Dr. Caldwell, because I'm going to meet with them to talk about mentoring. And so over that period of time, you get to know us each, and then we can talk about what we're doing from a research standpoint. And so we try to encourage everybody to select one main research mentor that can guide you for that second year. But also, I think all of us hope to serve in some part as a career mentor. That we can then continue to, guide you, maybe not about a specific project or anything like that, but to troubleshoot the process of going into your own practice. And I take time, I meet with all the fellows for at least an hour, once or twice a month. And those are not necessarily even structured times to meet. It's just, I feel like it's important that we check in to see how things are going, and those times are really dedicated for the fellow to dictate what we talk about and what direction that goes. And so I don't know if I hit on anything that you were trying to talk about, Jay, but I do think it's some of the part of training that I've enjoyed the most is just really getting to know the fellows and hopefully positively influencing their career.
Yeah, I would say to the applicants, I don't think I would have believed me if I were in your shoes saying this, but the reality is you're going to learn how to do the clinical and operative part of pediatric urology, no matter which fellowship program you match into for the most part. And so it's the intangibles that really make the difference program to program. And I found that at Colorado, there's this huge focus on making you a better person and a better doctor, not just a good surgeon, and mentorship and really stretching you. I really looked forward to those meetings with Nick, and it's not just Nick, it's everybody. But I have some very fond memories in Nick's office with Jonathan and paper planners and agendas. And I've taken those skills I've learned. I see Jonathan laughing. And all these books behind me are mostly recommendations from Nick for the most part. There's some Adam Grant and some, I don't know, James Clear and stuff up there that make you a more efficient, productive person, which would not have struck a chord with me if I heard this as a fourth year resident, but now as a new attending, it's incalculably helpful.
I like the very zen lighting you've got in the back. Again, I really, I know we're getting up close to 7, so I don't expect people to stay on. I fully know that you have lives, but I'm happy to stay on as long as we need. If any of the applicants have things that they want to ask, and that doesn't just extend, for this as a time limited thing. I actually had a slide that had my email address and and Mel's email address, also my Twitter handle, since I'm now so fancy. Thank you to Dr. Saltzman and Dr. Walker for dragging me kicking and screaming into the social media age. But we're here. I hope I speak for everybody. I'm gonna give everyone's email addresses, maybe not their home phone numbers, but we all want to be very accessible as you go through this process. If you have questions, things that we can answer, we want you to feel like when this process is coming up that you know as much about our program as you can, so you feel like maybe this is a place you'd like to apply.
I think I would echo that. I'm Kristen. I'm the incoming fellow. So I probably have the only experience of really interviewing virtually. I did all of my interviews virtually last year, sort of right when COVID was starting and nobody knew how to Zoom, and there were like FaceTimes, and it was sometimes very awkward. But I think for me, like fit was really important, and it's really hard to find how well you fit at a program that you've never met the people in person, you haven't seen like any more than, you know, this part of their bodies. So I would highly recommend, you know, trying to do the like breakout kind of informational sessions if they have like happy hours or anything like that before. I think that's a really good way to kind of get to know the people kind of in a more informal setting. I would say one of the things that, like I said, I haven't actually been to Colorado yet to meet everyone in person. But I was really blown away by just kind of the family feel that they had here. I think depending on, you know, which programs you look at, some of them you're going to have more of like hierarchy and sort of teaching, whereas this seemed very collegial, and everyone just speaks, you know, over and over about how they're really trying to kind of grow you as a person, grow you as a urologist. Like it's not just you as like a surgeon, it's you as a person, which I felt was really important for me. And I reached out to like multiple different fellows. So, you know, I didn't necessarily have anyone within the last few years who came through my program who did peds. So I reached out to a lot of the fellows, and, you know, if you have questions about anything, obviously like you can reach out to me about the application process, about the interview process. But it sounds like a great program. I'm really excited to come here. So.
Thank you for saying all that, Kristen. We appreciate it. And we're excited to have you join us.
Well, Nick and everybody, as Chalmers, I'm going to say goodbye. It was really great seeing everybody's face. Hi, Dr. Campbell. Good luck in the process. I miss you guys a lot. This was fun. I kind of want to do it again, regardless of an application cycle. Maybe
Yeah, I'm feeling bad. I feel like what I've uncovered in this is that what we need is like a quarterly alumni happy hour on Zoom. And I feel bad that we've taken over the open house with a fellow faculty love fest.
Right. I'll have to sign into a Friday afternoon conference. It was really nice to see you guys. Take care.
Thank you, Dave. I really appreciate it.
Bye-bye.
Again, I know that some of you may need to go, but I am happy to hang on till the bitter end. You know, if there are questions or anything that we can answer. Also, I know that it may be like not your thing to chime into a Zoom call where you know with people you don't know. So I'm going to type my email address here into the chat function. And feel free to shoot me an email if you have questions or anything you don't want to necessarily talk about in front of the whole group or anything. That's not my email address. That's
and I'm happy to
Dan's.
chat with anyone
just
as
want to
well.
make sure.
Sorry, I have to run back to the operating room, but thank you guys. Look forward to talking to you all hopefully sometime soon.
Thank you for taking the time. Good luck in the OR.
Thank you. Goodbye.
I feel like my peer pressure on the other faculty to put their email address in is paying off.
Maybe I could add another thing that I just thought of.
Please, yeah.
I think the having the Pena and Bischoff here with they do a lot of anal rectal malformation and cloaca, and I think that's a very specialized area that we that's not really advertised as much, but it's been really great to work with them. You know, it's all that stuff is very intimately involved with us in colorectal, and it's been really great to work with them. So I don't think many other programs have that. And then Another thing about, just to kind of emphasize again about the oncology experience, there's no other program where you get the experience like that. We place our own reports. I think I did like 14 wilms last year during my clinical year, and that's more than pediatric fellows get in many places during their entire fellowship. So, and that was just during my clinical year. So, and I know there are certain other programs where urology doesn't do any nephrectomies hardly ever. So that's just another plug for this program. And Nick, I know he'll be modest, but
Don't worry, I muted you that whole time, so nobody heard anything he said.
Thank you all for hosting this. See you soon.
Well, thanks for taking the time. Again, if we leave you with any message at all with this, it's just, how much we all enjoy working with each other, how much we enjoy working with the fellows, and how much we want this program to be about the fellows and about their career and what they're hoping to accomplish. That some places it's about supporting the existing structure of the faculty and their research and their clinical work. And if anything, we say that we want this to be about you and helping shape your career in whatever direction that is you want it to be. So. Okay, well, I feel like at this point people are staying on because nobody wants to be the first one to jump off, but feel free to leave if you'd like. Again, I'm happy to stay on as long as we need to. So.
Thanks so much.
Thank you.
Mel, thank you again for all of your hard work in putting this together. I really, really, really appreciate it.